Hello guys, my name is Noman. I'm going to discuss about two drugs that are really famous these days, Zepbound and Wegovy. To just give you some perspective, I'm a pharmacist both registered both in Canada and the US, and I have over 20 years of experience. I would like to make these series to show you guys the difference between the different drugs that are commonly available in the market. Now, these days, Zepbound and Wegovy are one of the most famous drugs, and some of the celebrities are using it, and they're making the huge difference in people's life. They help to lose weight. Now, to start with, how these drugs work, on the technical terms, these drugs work on a GLP-1 agonist. On the more layman terminology, you can say that these two drugs make you to have the feeling of fulfillment. Meaning, so when you use these drugs, and if you're using these drugs, the feeling you have after eating a meal, that you're fulfilled and you're not hungry, that effect, these drugs make it prolong. So that's how it works. In terms of side effects, the side effects are quite similar between these two drugs. Like Zepbound and Wegovy almost have identical side effects. The most common side effects we talk about is nausea and vomiting. So these effects usually happens when you are either starting the dose or starting the injection, or you're increasing the dose. Now, moving on, the cost. That's really an important point, because that really defines whether you can afford this drug, which drug you should go with. Between Zepbound and Wegovy, if you talk about the maximum dose of these two drugs, or the dose that is recommended for maximum weight loss, it costs around $1,000 to $1,200 without insurance. So if you have insurance and they cover that, that's really good. You're lucky enough for that. You can afford it, and then you can go ahead and use it. Now, moving on to the numbers. Now, if you look at the numbers, meaning how much weight you actually get to lose while using these drugs. If you look at the Zepbound, with Zepbound you lose up to 41 pounds of weight if you incorporate a good exercise plan and good diet plan. Versus Wegovy, you can lose up to 27 pounds of weight in a year, again if you incorporate good exercise and a diet plan. Now, Wegovy, yes, the numbers may not look good enough to compete with Zepbound, but with Wegovy there's one advantage. There are studies have shown that Wegovy also protects your heart against different heart events, such as heart attack and any other cardiovascular issues. So if you compare to molecule, Wegovy would give you a better deal in terms of protecting your heart, because one of the main problem with the obese patients is that they are more prone for heart events. So Wegovy give you that advantage as well. Now let's see if someone asks me which drug would you recommend between Zepbound and Wegovy. Of course, if someone is young and have no history of cardiovascular issues or heart events, I would definitely recommend Zepbound, because you're getting better values for that, right? Because you're losing more weight with Zepbound versus Wegovy. But someone who's obese and old and have high blood pressure and diabetes, Wegovy could be a better option for them, because those patients who are obese and are aged could have more cardiovascular risk as well. So Wegovy would be a better option for those patients. Now, the one final question. The problem with these two drugs is that, how long a person should be using it. Now, first of all, it is recommended for people who have BMI over 30 or BMI over 27 but have one health condition. So for those patients, these drugs are recommended. But I've seen in practice that a lot of people who don't even have, or not even close to BMI 30, are trying to use these drugs to have a cosmetic weight loss. Personally speaking, I would never use this drug. Now, the problem with these drugs is they help you to keep losing weight or keep your weight maintained if you just keep using it. So imagine you're using an injectable drug, and how long can you use this drug? So as soon as you stop using this drug, the effects of these drugs subsides, and you may gain all the weight you lost. So for me, it's really not a long-term solution for weight loss. For for someone who has tried many different things and nothing worked for their weight loss, for all means they should go with these drugs. For someone who can incorporate good exercise, have better control on their diet, and can incorporate exercise like on daily basis, then I would recommend to just stick with that rather than sticking with these drugs. So that's all from me. I thought I should bring this video for viewers who always keep asking questions about Zepbound and Wegovy. I hope this video may clear some of the confusion you guys have, and I'll continue with this series, and I'll bring more comparison between the drugs that are normally available in the market and are really famous. So see you in the next video. Please make sure to follow my videos and follow my channel. Thank you and have a good day. Bye.